Every one of us takes 25,000 breaths each day. Clean, breathable air is a crucial aspect to life, and polluted air can impact our health. For example, Philadelphia is a top 5 asthma capital in the United States, with pediatric rates roughly 4 times higher than the national average. Common pollutants have been shown to disproportionately affect communities with higher poverty rates and minority-majority populations. Government monitoring does not typically cover these areas, so one approach to address this burden is to equip the community members themselves with the resources to monitor air quality. One approach to this is the modern technique of low-cost sensing, which can provide evidence to drive change through future policy. I'm using low-cost purple air sensors and Ogawa passive samplers to characterize fine particle pollution, nitrogen oxides, ground-level ozone, and sulfur dioxide at 15 sites in West Philadelphia, both indoors and outdoors, across a 1.5-year study period. I partnered with a local environmental education center so that community members could participate as citizen scientists and directly receive updates about their air quality at their residences, businesses, and schools. But as you can see from the maps behind me, air pollution is not equally spread throughout West Philadelphia. Therefore, I analyzed spatial trends, temporal trends, and indoor dynamics related to peak exposure. After sampling, I found that peak exposure is not occurring when and where we might have expected. Indoor exposure was higher than outdoor exposure for particulate matter and for nitrogen oxides, but lower for ozone. PM 2.5 displayed high temporal variability with a clear diurnal pattern that raised in the beginning of the day and elevated weekend concentrations, which is an unusual observation. Seasonally, PM 2.5 and nitrogen oxides were elevated in the summer and winter months. These peak exposures, unfortunately, can cross human health thresholds. The good news is, though, from an annual perspective, PM 2.5 levels were below the EPA's National Ambient Air Quality Standard in West Philadelphia. My research demonstrates the effectiveness of low-cost sensing for air pollution. With this technology, I was able to have such a detailed exposure estimate both indoors and outdoors in a single urban neighborhood. My study had high community participation and high data dissemination that ultimately bridged the gap between science and human health in our societies. Thank you.